Well, good evening and welcome into OpenLine. I'm Chuck Long on this very chilly evening. We are glad that you are watching us. And of course, this is our Ask the Expert night. And tonight we're going to be asking the endodontist. And we're very glad that Dr. Richard Horwat is with us this evening. And good to see you as always.
Thanks.
Now, you guys know, or if this is the first time you happen to be tuning in to OpenLine, this is your forum. So when you have a comment, when you have a question, just jot it down, give us a call at 737-7587. And when we're talking about endodontics, I mean, we always get a lot of callers when Dr. Horwat is here, but so many things to think about. Everything from the care and the treatment of so many areas of your mouth. I mean, I know a lot of people see the endodontist for the root canal, but for saving a tooth, a chipped tooth. If you have questions and you're wondering, this is the guy to ask. So we're just going to jump right in. I know you just came right from work. It is a busy time of year for you.
It is a busy time of year. It does kind of appear to be seasonal. You know, we'll have a couple of days where it's not as busy, you know, and then look out, you know, schedule's halfway filled up, and by the end of the day, it's filled up with emergencies. So you never know.
What would you say, you know, kind of starting at the top of it, what is the number one reason someone comes to see the endodontist?
The number one reason I think is someone comes in is they need a root canal for one reason or another. A lot of times it's because either an infection that was dormant and you have a tooth that wasn't giving them any problems at all, and then some type of stimulus will come along and trigger that bacteria and wake the patient up a little bit and say, let them know that they're there. And oftentimes for an emergency, that's kind of what it is. Sometimes a dentist will be doing a restorative procedure or a filling, and the decay might be a little bit more extensive than they had anticipated. And sometimes it goes into the nerve, and we may get a call from them, and they'll ask us, they may not have a dead tooth, but they might have an inflamed tooth, and they want to go ahead and get that nerve out of there before it causes any discomfort. But that's a lot of them. And of course, you have your traumas and things like that. You have people that just sports events or on, you know, someone might take a fall.
Right.
And then we have to, you know,
take care of that
immediate attention.
Yeah. Well, and again, I know sometimes people, it's like the great unknown. They hear root canal and they get really afraid, but that's not always the case. And we're going to go to our callers right now. Judy is on the line with us. Good evening, Judy. Thanks for calling. Do you have a question or a comment for Dr. Horwat?
Yeah, I got a question.
Okay.
Can you hear me?
Yes, we can. So what's your question?
Years ago, I went to the dentist, and my teeth were in good shape, and they told me I've got a gum disease. So my teeth started cracking and breaking off and stuff like that. But what I was wanting to know, I don't have no dental insurance, but I have health insurance. And somebody told me all my teeth would have to be cut out. So I was wondering, would my health insurance cover any of that?
You know, I don't know the answer to that. Insurance has changed a lot over time. You know, I knew insurance really well 10 years ago when I kind of needed to. Now I kind of delegate that type of thing out. With regard to the insurances, though, you know, a lot of times medical insurances won't really help you out too much with the dental concerns unless something happened that is also with a medical concern, like a car accident or something like that. They may help you out with that regard. You might want to contact your insurance company or insurance carrier and just find out what they do cover and find out what your, you know, what type of benefits they will take care of. Every now and then, you know, I have sent cases out to where I have to write a narrative to an insurance company that might not be a dental insurance. A lot of times it might be for an auto accident or something like that, or it might be for, you know, from the auto accident, might be for legal reasons as well. But generally, I don't think that most of your medical stuff is covered. I was told that some of the medical companies will cover things like IV sedations and things like that. But again, I'm probably not qualified to really go in too deep about insurances and what they do and don't do.
Okay, well, thank you.
All right, well, we appreciate you calling, Judy. Have a great evening. Stay warm. All right. Thanks for calling. You know, another thing I forgot to mention at the top of the show, Bluegrass Endodontics is where you practice.
Yeah.
And you guys have offices in Hendersonville and Mount Juliet. And Dr. Salmon, I know, was here with you last time. You said it's seasonal. What makes the endodontist business seasonal?
You know, it can be seasonal. As I mentioned before with the bacteria, it can remain dormant. You know, a lot of times I think that the bacteria is there. It's not really giving a patient a problem. But when that right stimulus comes along, it'll wake the patient up. A lot of times that can be maybe you bit into it just right, or you ate a type of food where the temperature was just right. A lot of times I think it has to do with the pressure in the air. I notice that in the fall season, I get a lot of patients that come in. I think that the changes in the pressure in the air, I think the bacteria respond to that. Sometimes I know that I get a lot of patients that tell me that everything was okay until they went on an airplane, and maybe the pressure from the airplane may trigger it. Other seasonal things are, we spoke about insurances here on the phone. People want to utilize their insurance before the end of the year. At the first of the year, that insurance likes to replenish itself, but that can be inconsistent too, because they might want to save the money on Christmas gifts and things like that. But
Right.
it does tend to be seasonal. I notice that in certain months it does kind of drop off a little bit. I notice that there's certain more emergencies coming around spring when people are outside more in sports events and things like that. But it does tend to be seasonal.
Right, and I know you're very busy. Like I said,
now I'm busy, yeah.
just came from the office, so
Yeah.
our line's getting very busy. So do thank you for calling in.